Good morning, everyone. This is Braulio Rose, Executive Director of the Broward County Bar Association. It's my privilege to have Dr. Carmen Shirley with us today. We are celebrating our Black History event and honoring those uh, first responders, medical professionals uh, for Black History Month. This is a partnership with the Broward County Bar Association, the 17th Judicial Circuit, and the TJ Reddick Bar Association. So with that, welcome, Dr. Shirley.
Thank you. Glad to be here.
Wonderful. Thank you, doctor. So could you please describe your medical specialty? Why did you choose that specialty?
Okay, my medical specialty is family medicine. I chose the family medicine residency to um, fulfill my desire to take care of patients from birth to grave. It was the one specialty that allowed me to combine my love of pediatrics, OB, and internal medicine all in one specialty.
What challenges exist for Black doctors to come in to meet in South Florida or even in the nation? What challenges are there?
There are several challenges. I think one of the biggest challenges right now is trying to close the uh, healthcare disparities that exist between people of color and other people. Encouraging patients to just get primary care and get access to primary care is a big challenge. And that's one of the reasons why I chose a primary care specialty so that I could be a part of that movement to close that gap.
So you had already alluded to that there are some racial disparities when it comes to medical care. Could you elaborate on some of those disparities on medical care and treatment for African Americans?
There are several. First and foremost, just getting access to having a primary care home is one of the biggest challenges. Once a patient has a primary care home, the remainder of the access to healthcare becomes quite easy. So getting patients to a primary care physician is a big challenge. And there are several things that contribute to that. One being um, patients oftentimes lack transportation to just get to a doctor's office. For example, here in our county, in the 33311 zip code, there is really only one major primary healthcare facility. There are no private practices in that area, and so patients have to travel outside of their county, outside of their zip code, to see a primary care physician. Um, that's one of the biggest challenges I think that I see here in our county. Um, Aside from that, um, having access to seeing specialists to take care of the many chronic conditions that plague our community, cardiac conditions, pulmonary conditions, kidney conditions. So, we have higher stats in terms of hypertension and diabetes and coronary artery disease and strokes. So with that, once again, I go back to this, that access to primary care is the key. Once we can close that uh, um, gap and get access to primary care, getting access to having insurance in and of itself is a whole second topic. But once we can, I honestly believe that once we can provide effective primary care, I think we would be able to see a dramatic decrease in some of these conditions that seem to plague us. Education, just educating patients on how to live healthy so that we can prevent some of these problems from coming is another problem. Uh, and so it really does take a lot of community resources to do that. Building patient trust. Our people have had a history of being experimented on, and so our people do not trust our healthcare providers. They don't trust that their best interests will be held in mind. And so that also leads to them not seeking access to care early, where we can catch some of these conditions. And so these are all contributing to why there is such a big gap in our healthcare system.
So You already alluded to it. It's a question I was going to ask later on, but let me go ahead and ask it now. As it relates specifically to COVID-19 and the various vaccines that are being distributed, how can doctors and other medical professionals convince the Black community about the dangers of COVID and the efficacy and safety of the vaccine?
As you know, the statistics of COVID and mortality amongst African Americans is very high. Um, One, we don't have access to primary care. We don't trust science. We've been experimented on in the past. We have to educate our people that the problems that existed in the 50s and 60s in regards to experimentation, um, those all of those things have changed dramatically over the last 50 years. Uh, um, and so we as physicians have to lead by example in regards to getting the vaccine ourselves, and then educating our patients that the vaccines are safe, that the research is sound, and encouraging them to do the same so that we can decrease the curve and try to get this pandemic under control.
So, segueing from the now to the past, can you talk a little bit about the legacies of doctors Mizell, your father, Dr. Shirley Sistrunk, Morris, and Brown, and the impact on Broward County and the healthcare system here?
Wow, what a great history we have. Our first pioneer physician, Dr. Sistrunk, literally paved the way. Him and Dr. Mizell starting Providence Hospital. That was the very first opportunity for people of color here in our county to have access to public health care. Uh, Dr. Brown, being our pediatrician, was able to give care to our children. My father joined the group as an OB and brought over 6,000 births to our county successfully. And so they did pave the way. They paved the way to have physicians of color uh, be able to gain privileges on staff at Broward General at the time. And that opened the door, not just for people of color, but other peoples, Jewish people, Indian people, Latino people. And so I am honored and blessed to have been the daughter of one of those pioneering men. That has opened the door for women to enter into the world of medicine. Prior to, we were primarily nurses. My mother was one such nurse who actually was a pioneer along with Cora Braden in establishing a nursing teaching program that was then at Dillard High School so that they could train their own nurses to staff Providence Hospital. So our legacy here in Broward County is very rich, and I am a product of that. And I'm so proud of that.
Beautiful. And so, to continue that tradition, what would your advice be to Black youth interested in pursuing a medical career?
Wow. I was blessed to be the daughter of a physician who was also my mentor. We as physicians, we need to be mentors. Our youth need to see someone who looks like them in the medical world and encouraging them to pursue the sciences. And it starts at a very young age. We have to capture these young, bright kids when their brains are willing to absorb all of this information and science, and then encourage them to continue that through their high school years, and encourage them to go to college, go to university, major in the sciences. But more than that, to apply to medical school. It is a long journey to get to become a physician. And it starts with planting those seeds when they're very young, and helping them understand that it is a long journey, and that there are several of us in the community who are willing to serve as mentors and guide them along the way.
Well, if you have anything else to add, Dr. Shirley, because we're kind of coming to the end of this, that you might want to just share with us any pearls of wisdom.
I'd just like to thank you for including me in this celebration of Black History Month. I always look forward to this month every year. It gives me a chance to honor my father, who I miss dearly. And I would not be the physician that I am today if it were not for him encouraging me, taking me to his office at the young age of 5. And from the time I was 5 until I was in medical school, I always did something in his office. I started out with answering phones, and then we would file charts, and then he taught me how to clean the equipment. And as the years went on, he gave me little nuggets of medicine here and there, and he allowed me to participate with him. He would take me to rounds in the hospital. So, I am truly blessed, and I am who I am because of him. And I now have a daughter who's following in our family legacy. She is the third generation. She's currently in her residency program at University of Florida in pathology. So it's just a wonderful thing to be able to continue the Shirley legacy of medicine.
And it is a beautiful legacy. And I'm actually sitting here and I'm proud for you and your family. So
Thanks so much.
congratulations on that and blessings for that.
Thank you so much.
Wonderful. So it's been my pleasure, as I said, Doctor, and thank you to everyone who's watching this. And I hope that you take away uh, some knowledge from Dr. Shirley.
Great. Have a great day.
Thank you.